Good afternoon, everyone. Thank you for being here today. There's several things that are newsworthy. I want to go over those with you. We have fortunately been able to increase testing at the American Airlines Center and at Ellis Davis Fieldhouse, so that now we can do up to 500 tests per day. We have also relaxed the requirements to get a test there. And so if you're over 65, you need not have a fever or symptoms to be tested there. You can be tested at either of those places. Just bring an ID. If you have an underlying health condition, diabetes, heart disease, hypertension, you also can be tested even when you're asymptomatic. So come and get tested there as well. For everyone else who's under 65 and doesn't have an underlying health condition, you'll still need to have a 99.6 fever and either shortness of breath or a cough. All right. Also, we've increased our testing capacity, or will next week, with two new Walgreens sites, one in Dallas County and one in Tarrant County. The one in Dallas County will be on South Buckner Boulevard. The one in Tarrant County will be on West Camp Bowie Boulevard. And those will be able, once they're online, to do a maximum of 160 tests per day. Those tests are free. Those tests have a one-day turnaround. We have been told by one of our labs, I believe Quest Lab, that the turnaround time will shorten, so that instead of people waiting a week when they go to Ellis Davis and AEC, it'll hopefully get down to about 2 days. So that also is good news. We continue to work. We've got the state of Texas working with us. Now we have DSHS, the State Department of State Health Services, the governor's office, and several others working with us to try to get those reagents and those machines that we need to turn UT Southwestern and Parkland into super labs that can do thousands of one-day tests a day. Again, they're the labs, and then you'll get your test by going to the hospital clinics and the Parkland community-oriented care clinics that are not necessarily UT Southwestern clinics. So, for instance, all of the Methodist clinics in South Dallas will have, once we get that up and running, we'll have the ability to do tests there. So that's good news. Also today, we have news of a change in wearing masks to the grocery store and the big box store. So I want to talk to you about that. I asked the healthcare doctors and the public health people, what can we do to speed this thing up so we can get back to our lives faster? And one of the things that they came up with, they can speed things up while also protecting you and those frontline heroes, those essential business heroes, is for you to wear a homemade face covering while at the grocery store or going to the doctor's office or other essential business. Also, if you're an employee of essential business, to wear that at your workplace will also keep you and your coworkers safer. I brought with you a little show and tell of things that you could use as a mask. I'm sorry, forget mask. We're not asking anyone to go buy a surgical mask. We need those actually for our response, and there's a shortage of those. We're asking people to use a face covering. So, of course, you can buy things that are specifically for being a face covering. But you can also, and these are just things I picked up at my house in 5 minutes before coming here. You can take something like this and put it around your mouth when you go. Here's the quick plug for the Cowboys. Here's the free gimme scarf from a Cowboys game, okay? So anybody that has those, of course, you can use one of these masks that are specific for the purpose, these homemade masks that are specific for the purpose, which you can easily make out of a piece of cloth or a bandana and 2 ponytail holders, okay? You can use a pillowcase. Here's a pillowcase, and tie that up like a bandana around your nose and mouth. You can use any of these things that we wear for warmth in the winter. This is a ski balaclava You just pull that around your face. And then if you want to look like you're doing a mug shot, you can use a towel. Okay, you can tie up a towel. And so don't think of the requirement for a face covering as something that is in any way insurmountable. By the way, one of the easiest face coverings is to take out anything that measures and any old cloth and cut out a 27 by 27 inch square of that. That makes a large bandana, like the cowboys wear that are riding through the dust storm. And that can be tied around your head and make a covering as well. So the idea of the covering is not because things are getting worse, although we are moving towards our peak, so we will see, more cases and more deaths as we move towards that peak. But it's not that things are getting worse. We're actually flattening the curve. But by doing this, we hopefully can get this over with faster and keep people safer while we're getting it over with. All right. Let's see what else we have on here. Let me just play some rhetorical questions with y'all. Do I have to wear my mask while I'm riding in the car to the grocery store? No. Do I have to wear my mask while I'm out walking around my neighborhood? No. Do I have to wear a mask at all? Okay, it's not a mask. It's a face covering. So anything will do that is thick enough to keep your breath from getting on other people and their breath from getting on you. I was told by Phil that a good test for this is to take a spray bottle of water and put a mirror on one side and you're covering on the other side, spray, and if the mirror gets wet, it's not thick enough. But if it stops the couple of blasts of water, not to soak the piece of cloth, but if it stops the water, then you've got your covering. Okay, so I don't need it to jog, I don't need it to walk, I don't need it to ride in my car. When do I need it? I need it when I go to the big box store or the grocery store. And I need to make sure that my kids have it on too. Well, will the police be out fining you? No, they won't be out fining you. Well, then how will this be enforced? Well, we want to honor our frontline workers that are risking so much to make sure you have what you need. And so I think most people will comply with this just as quickly as they can. Eventually, for those who do not, the stores have the right to refuse service to you. And so this was done. This is not me coming up with an idea. This is done with public health saying this will speed this up. This will get this over faster. This will make us safer. And then me talking to the people that would be most affected by this, the Texas Retailers Association, who said this is good. Uber, who said this protects our drivers, this is good. DART, who said we've been wanting to do this and we're trying to push it, and you making it a requirement is good. And so don't think of this as an abridgment of your freedoms. You still have the freedom to do everything that you had today and yesterday. It's just you're going to do it a little bit more safely for you and your family and the public and our frontline workers at the grocery store by wearing your face covering in there. And also, somebody points out, although this was a recommendation of our local health department and our local medical community, it does follow the CDC guidelines of what they are recommending as well. And so with that, Phil may have more on face coverings, but if we got, and I don't see it in here, let's see, here we go. I'll go over with you. So we had 7 people die yesterday, and we are announcing those deaths today. 3 were residents of nursing homes, 2 in the city of Dallas, 1 in the city of Richardson, and the other 4 were people outside of nursing homes. We have people, as we do when we announce deaths, we have some with underlying conditions and some without. As we look at this first 50 people who've lost their lives, and for that matter, all the people who've been hospitalized, about 69% of our people who have been hospitalized are over the age of 60 or have an underlying health condition. So about 31% don't fit into those categories. And again, about 30% of the folks who have been hospitalized have diabetes as one of their underlying conditions. Phil may have more on that. Let me, before I turn it over to Phil, let me say this. I know that we are all anxious for good news, and there is some good news, out there, right? We're getting more testing. We're getting closer to that peak day. All the medical models are showing a flattening. But at the same time, all of that is based on us continuing to exercise good personal responsibility, right? If just 20% of us say we're going to move away from the order and do what we want to do, then that is going to lengthen it, of course, for the 20% that do that, but that is going to lengthen it for all of us. And I want you to think about the people out there. You very well may be one of them, but people that are hanging on by their fingernails, that aren't working, that aren't getting a paycheck, that haven't seen that government money come in. Businesses that work their whole life for their small business, hanging on by their fingernails, praying that this will be over soon. And so to honor the sacrifice you've already made and the sacrifice that they've already made, please follow these guidelines. Please follow these orders. Please continue to do what you've done as a community. This community has done a great job in embracing safer at home and embracing moving away from selfishness to moving towards sacrifice personally for the betterment of the community. And that's why you're seeing the curve flattening. If we back off of that, and it's human nature, right? It's human nature to take your foot off the gas when you feel like you have a lead. But when we do that, it just puts us in a situation where we drag this out longer. So keep making those good personal responsibility decisions. Only go to the grocery store and the big box store when you need things. Make a list ahead of time so that you're not finding yourself going 4 times a week. That every trip we make outside of our house is some risk to ourselves, to the frontline workers at the stores, and to the community at large. And so make a list and go 1 time, not 4 times. Don't use, and I know people are anxious to get out of their homes, but it is beautiful weather. So, walk the neighborhood, sit outside to your heart's content. But please don't use the big box stores or the grocery stores as an entertainment venue, okay? Don't go to window shop. Go to get what you need for those essential trips, and then leave and let other people get what they need. We're seeing a lot more, I had both the police and the nurses tell me this morning. As they go to work, they see a lot more cars out on the roads. And it worries us because the more people that are out there bouncing around, the more this thing spreads, the longer it is before we can get this over with. And don't we all want to get this over with just as quickly as possible? So with that, I'll turn it over to Phil Wong, and we'll take questions from you.
Thank you, Judge. So yes, today we're reporting an additional 80 new cases, brings the total number of cases in Dallas County to 2,066 now, so we've crossed the 2,000 number. As the judge mentioned, 7 additional deaths reported today. Also, in terms of the jail, we now have a total of 51 inmates have been confirmed positive. And 8 additional jail employees have been identified as positive. With respect to long-term care facilities, Winters Park Nursing and Rehabilitation Center, 2 residents or staff members positive, 1 death. Brentwood Place 2, 10 residents, 1 death. Villages of Dallas, 1 resident, no deaths. St. Joseph Village, 1 resident, no death. Brentwood Place 1, 60 residents or staff members and 5 deaths. The Reserve at Richardson, 8 residents and 2 deaths. Edgemere Luxury Living, 11 residents or staff members and 3 deaths. Skyline Nursing Facility, 46 either residents or staff and 1 death. And Monticello West, 19 residents or staff and 4 deaths reported there. Did want to show just a couple of things. This is the just how the number of cases that we're seeing in Dallas County compares to the other 10 largest counties in the country. This first slide actually shows New York, and you can see New York just does overwhelm the other counties in terms of numbers. And then if just removing New York, so the next slide, when you exclude New York City, you can blow up and break down more these other counties. And so the next highest, it's Cook County, Chicago, Los Angeles, Miami-Dade, then Harris, and then Dallas then is in this group on down in this section. And then Orange County is the lowest of the 10 largest counties. Now, one thing, next slide, I just wanted to mention that the judge mentioned, you know, and we had a big call with all the different groups working on modeling of the disease progression today. But all these models and what we've been talking about are dependent on everyone continuing to really be vigilant with the stay home, stay safe, sheltering in place type of model. This is a look at, and this is the beta sort of, it's a indicator showing sort of transmission, how transmission rate, like the number of, it's essentially like number of new infections per day that a person would transmit. As the shelter in place progresses, we want to see that transmission rate slow down. And if you remember when we presented some of the models earlier, that blue line was sort of our model for how that was progressing with doing really good stay home, stay safe. And this is based then, that orange line is actually based on our actual data now. So what's, you know, a little concerning, just we're deviating a little from what that model was of the stay home, stay safe, and what that mitigation is. And it's just, and so it does affect some of the progression, the model projections. So that's what we're working with the models again to see how, and every day looking at new numbers and see how they affect the model. But it's something, just a reminder how important it is to still stay vigilant on this and you know, continue to stay the course as we're sort of showing the effect. And again, you know, you can start to see perhaps a little more traffic out there as things, and that's where just a reminder, we really need to stay vigilant on this. And then as we get through that first wave, then we can start looking at how to move forward. So I think that's all I've got. Right.
Again, before we take questions, you know, we have a group that's looking at how do we loosen restrictions and get that first group of businesses back. But that depends on two things, one that's out of your control and one that's in your control. The one that's in your control is how fast we get to the peak and then get to some level below the peak so that the doctors are comfortable letting us try that. Okay, that's within your control. By you making good personal responsibility choices, you can control, just as you flattened the curve so far, you can control how fast we get to that point. The second thing that's not in your control that we're working like heck on is to get more testing here. We have to have a lot more testing around those businesses that reopen to be able to effectively monitor that and get that done. Part of that is what we're doing and having a lot of success with, probably having more success than other urban areas are, in constantly drawing more tests into us every day. But also the other part that is beyond anything that our team here can do is we have to get the IgG and IgM antibody test to actually work. Right now it's virtually useless. The one that they have, that they're testing in DC, has so many false positives that it would the doctors say we can't really rely on it. So, but that first one's within your control. Those good personal responsibility decisions that get us there faster is within your control. So any questions? Yes, Candace.
You said that wearing the face mask out in public comes from you asking public health officials what we need to do to speed this thing up. Can you quantify that? You said a couple of days ago that the peak can be expected end of April, mid-May. So does doing this change that peak? Does that move the peak back? What are they giving you in terms of a timeline as a result of wearing these face masks?
Okay. Are you mic'd, or do I need to repeat that?
I'm not mic'd.
Okay. So the question was, what are the public health officials telling us as far as people wearing the mask? How much of an impact will that have on moving us forward to being able to open that first tranche of businesses? As you can see from his model here, from the decay model and the trend model and the observed model, if we're observing less spread, less movement, and more people are compliant with this, then that will begin to work into the models that Dr. Pearl and others do every morning, and we'll begin to see how many days that moves us forward. It's hard to answer the question in absolutes as to when that will happen, since I can't tell you absolutely if we don't do it, what the day is that we would be safe to open that first section of business. But there's a group of policy folks, there's a group of big businesses, small businesses, community leaders and healthcare leaders and labor leaders that are all looking at that, and what is this first group of businesses, what will it look like, and then how well we all do with mitigating our risk and our danger determines when we get to that point on the curve where the doctors will give us a green light to do that, and then we have to have testing around that to make sure that we don't create a second wave, which can happen, as you know, as I keep telling you. Even if we do it right, we could have that, but we want to do everything right so we minimize the risk of having that. What else? Yes, Andrea.
I'd just like you to comment on the shift in messaging, because I know early on we were told that masks probably wouldn't make much of a difference, and now we're at the point where they're being required by the general public. And then also, I was curious if you plan on wearing a mask starting Saturday.
I do. If I go out to the store, I'll wear a mask. If you see me walking around the neighborhood, you don't have to wear a mask walking around the neighborhood, so you probably won't see me doing that. I think it's very important that we do that, that we all do that. So I'll be doing it. My family will be doing it. My employees will be doing it. So yes, we will. The other, sorry, you asked me, was I going to wear a mask? And what was the other question?
The change in messaging.
Oh, the change in
Early
messaging.
on,
Yes.
We had asked about, because a lot of people were, sewing cloth masks, trying to help, and
Right.
we
So-
heard that it probably wouldn't make a difference, and now we've gone from that to it's going to be required. So just kind of like what.
So, the doctor started off with the premise that a cloth mask or a bandana really affords, no protection, and they then changed that to it affords some protection, and now you're seeing them say that it can speed this thing along. And so, I'm listening to the science. If the science says tomorrow, hey, try something different, we'll try something different, because that's our best pathway out of this is to listen to the science and the public health doctors and Dr. Fauci and the doctors here locally like Dr. Wong, and let them guide us through it. This is not a time for a group of elected officials to sit around a table and decide how much of science they want to listen to and how much of science they don't want to listen to. It's a time to take the information, whether it's new information, a change from the old information, and act decisively and implement it effectively so we can just get this over with.
But has the science changed in the last couple of months? or
That'd
is there
probably
really no-
that'd probably be a Phil.
I can
Yeah.
say one
You need
thing
the mic.
about, one of the reasons the mask recommendations changed is because of the increased recognition of asymptomatic spread. And so that there are now more people who even they don't have symptoms, and that during that time period, you can also spread the infection easily. And it was, initially thought there was only when you had symptoms that those droplets and things were transmitting. But they found now more and more that even in that asymptomatic period, you can transmit. So these are more to prevent, if someone has asymptomatic infection, to keep them even talking sometimes, that you could spread that. And so this prevents that spread from someone who doesn't have symptoms. Not as much for protection of you. That's why it's still so important to still practice the physical distancing. But this is for people who don't know they have it, and to prevent that transmission also. And that was new information. Again, and we've said all along, we're learning more and more about the virus, the way it's transmitted, and that was the newest thing that changed some of these recommendations.
I think he's got one for you.
Doctor, and I know this hasn't really been done in many parts of the country right now, but is there any hard data you've been privy to that shows how much this could help flatten the curve if we were going to be wearing these coverings day to day?
Again, it's based on that recognition of how important asymptomatic transmission is in the spread of what's going on. So it's certainly, the masks do prevent that droplet spread. And we have always said, if you were a family member, put masks on anyone who was sick or had illness, and if you were caring for a family member. But we know that these can prevent those droplets from, spreading out further. So certainly, again, it will help prevent some further infection and transmission. All of this is new. We've never, certainly in my life, had a recommendation for everyone to be wearing masks. So in terms of, evaluating that, but definitely that makes sense, and because of that recognition of asymptomatic transmission.
Judge, should the homeless community be expected to follow these same guidelines? Are there any exceptions for our homeless neighbors?
So the question was, should the homeless community be expected to follow the same guidelines? We do have an outbreak now in one of the homeless service providers, and it's very hard. The homeless population encampments, similar to the nursing homes, very hard to control spread there. So yes, to the extent possible, our homeless neighbors should follow those and should, cover their mouths. It's important for us all to remember we have to show grace towards everyone, right? So the fact that we have this doesn't mean on Saturday it's time to accost people at the grocery store for not wearing a mask, or to find a homeless person and accost them for not wearing a mask. We'll go a lot further towards protecting all of us if we encourage rather than accuse, right? So yes, it would be very helpful, because that is a very endangered population right now if homeless wore masks. And so we'll work with our service providers to provide free face coverings for them there, because they have so little, they may not have something to make a covering out of. And so, of course, it's also hard for them to wash their clothes, given where they are. Any other questions before we wrap it up?
Judge, so you mentioned the importance of testing. I've spoken to some in the community out there who are undocumented, and they have certain questions as far as the testing. Does this cost them anything? Do they need any sort of documents to be able to be tested? And what happens if they are positive?
Okay, so the question was, what about people who are undocumented? Do the tests cost anything? The tests are open to people who are undocumented, and they are free at our test drive-through test sites at Parkland Hospital, Amelia Court. You have to be a Parkland patient to go there. At AAC and at Ellis Davis, the tests are free, and you're not required to be a citizen of the United States, and you're not required to be a county resident. You can also be from a surrounding county to get a part of those federally funded tests, to take one of those tests. It's absolutely essential that people who are undocumented get tested if they fall into a high-risk category, or they are showing symptoms, right? It's called public health for a reason. Whoever you are, We need to know that you're sick, and we need to trace who you've been in contact with to protect your family, your neighborhood, and really all of us. So we want everyone to have access to health care. Now, let's say an undocumented person needs to be hospitalized. We will get them hospitalized. We'll get them the care that they need. So you shouldn't be afraid to come forward and get testing. And regardless of what your political view is on the undocumented, everyone should embrace the fact that right now we want to find the folks who are sick, help them, and keep them from spreading the virus. So it does not count against the public charge rule. So I know many people are trying to get their green cards, and there's a new rule out that says if you do anything, if you take any kind of government assistance, it can mess up you getting your green card and eventually perhaps becoming a citizen. Well, this doesn't go against the public charge rule, all right? This is run by Parkland Hospital and the City of Dallas. So Parkland Hospital and the City of Dallas are not allowed, nor would we, if we had the discretion to, turn over health information, private HIPAA health information, to other government agencies. So your information is secure, it doesn't cost anything, it doesn't go against the public charge rule, and you get the same health care as everyone else. That's the best way to protect public health for all of us. All right?
Which of those providers you said has an outbreak? You said it was a homeless provider or a partner. You said that there's an outbreak somewhere when I asked you about the homeless community.
I don't know if that's public information or not, but certainly that provider's been notified. Everyone who was there has been notified. We're doing an extensive tracing there. So there was a question about which homeless provider was it that had that outbreak. So I want to thank y'all for just staying the course, for sticking with this, for being really vigilant about keeping your family and your community safe. It's because of you. It's not because of me. It's not because of elected leaders. Okay, elected leaders, they can call on people to follow science and reason, or they can go the other way. But ultimately, it's up to you to decide what the response is. And you've decided that the response is going to be that the people of North Texas will move away from selfishness, move towards sacrifice, that they'll overcome their fear by having faith in the science and following that science, and they'll turn away from panic and move towards personal responsibility. We've got to keep doing that. And April is critical. We've got to continue to exercise that personal responsibility, flatten that curve, so we can get this over with and get back to our lives. Thank y'all.